Ladies and gentlemen, welcome to MedSynapse podcast series, where we delve into the forefront of medical expertise. I'm your host, Dr. Nigar, and today we have the privilege of engaging in a profound conversation with Dr. Hamidreza Rokhsatyazdy, a distinguished neurologist with over 12 years of experience in adult neurology. Dr. Hamidreza serves as a neurology consultant of Irfan Grand Hospital in Iran and the Windsor Medical Center in Dubai. With a robust background in evidence-based and cutting-edge treatments, Dr. Hamidreza specializes in a spectrum of various neurological disorders. Notably, he has contributed significantly to the field, having published a book on awake craniotomy and numerous articles in evidence-based journals. Today, our focus revolves around the latest advancements in migraine management, a topic at the heart of Dr. Hamidreza's expertise. We will be exploring insights into these advancements, the challenges, its solutions, and diagnostic approaches, effective collaboration in comprehensive patient care, and the opportunities and challenges posed by telemedicine in the world of migraine management. Welcome, Dr. Hamidreza.
Hi, thank you for your invitation. It's my pleasure to be with you and with your followers.
Thank you so much for joining our MedSynapse podcast. It's our pleasure to have you today on this very important topic.
Thank you very much. I am at your service.
Thank you, Doctor. Before we begin the podcast, I would like to ask one personal question. Dr. Hamidreza, with your roles as neurology consultant at Irfan Grand Hospital in Iran and the Windsor Medical Center in Dubai, you navigate the complexities of healthcare in both these countries. Could you please share with us how you manage working in such distinct healthcare environments, and are there notable differences or similarities that stand out to you in your practice between Iran and the UAE?
Yes, a very great question. We have some difference in the healthcare system for prescribing the medication and also for different drugs that are available in UAE or in Iran. So we need to choose the best way through what medication is available in UAE or in Iran. So our strategy for the treatment is different. Second, we have a different policy for insurance that the payment for the patients is different, and the strategy that for diagnosis the disorder is different because we need to consider the financial and economical situation of the patients both in Iran and UAE with their difference and the high expenses of some investigations such as MRI or lab tests. So here we need to be more careful about these things. But because we have a near cultural issues and we have a good comprehension about and explanation about how to feel, how to explain our pain and discomfort. So it's very similar. But in the strategy of the healthcare system, because it's different, there are many differences between Iran and here. So I try to learn both of them. In Iran, it's simple for me. Here, I learn it and I use and I go through the DHA rules here to give the patients the best and effective treatment, diagnostic and treatment strategy.
Thank you so much, Doctor, for offering the insights into your professional journey and at the same time for sharing with us the differences and similarities between the practice in Iran and the UAE. Now, let's begin with our podcast.
Yes, I'm ready.
Dr. Hamidreza, to begin with, how are new developments in neurology changing the way we handle migraines? And how can doctors use this knowledge for patients?
Nowadays, there are three new ways to treatment of the migraine headache newly added to the conventional and previous treatment tools. Previously, we just have an antidepressant or anti-epileptic drug that used for controlling migraine headache, such as sodium valproate, topiramate, something like that. They have many side effects, and they are not specific for the migraine. When the patients search, they said, okay, I'm not depressed, why use prescribe for me antidepressant? We need to speak with them that this is for your migraine treatment, and it has FDA approval also, and it's the correct medication. But nowadays, we have 3 new methods for controlling migraine headache. The first, in last 10 years, we use Botox for controlling migraine headache. We injected Botox to botulinum toxin, 100 units of the Botox in all space of the skull, muscles of the skull, and also on the neck and the shoulder, where there is the trigger points of the migraine. And we get a very good response on the patients who cannot use the medication, or they are not responding to the medication. In drug-resistant chronic migraine headache, we get a very good response. And also in cluster headache, this Botox injection helped many patients. After that, the TMS get the FDA approval from 2016, transcranial magnetic stimulation for controlling migraine headache. And nowadays, from 2 or 3 years ago, there are anti-CGRP and GEPANT drugs that they are monoclonal antibody that specifically inhibit the CGRP channel in the brain that is responsible for the pain circuit in the head. So we can use these drugs to specifically controlling the migraine headache. And one of these anti-CGRPs also have a good effect on the cluster headache. And also GEPANT, because before the GEPANT we have the triptans and ergotamine. It's have a very bad effect in cardiovascular patients. It's increased hypertension. These drugs made medication overuse, headache. After the patients use, for example, 1 tablet per week, then he needs 2. Then he needs every day. Then I have a patients that they use 4 or 5 triptans per day. Why? Because there is another issue these drugs made that we name it medication overuse headache. Somehow they are addicted to these triptans. When they use the triptans, their headache relief for 2 or 3 hours. After that, the headache starts. Then use another one. So with this new medication, we don't have this medication overuse headache side effect. And also, the effect of this medication are long lasting for 72 hours, for 3 days. So it's very helpful, and it's not like other NSAIDs or, for example, acetaminophen or paracetamol that they are generalized. We use generally for any pain, for example, joint pain, muscle pain, back pain. It's specifically just for the migraine headache, and they do selective pain blockage on the brain for controlling headache.
Thank you so much, Doctor, for sharing with us the interesting new developments in neurology when it comes to the way how we handle migraines. It sounds very interesting, especially the idea of botulinum toxin. Now, moving on to our next question, could you please tell us more about these latest ways and methods to treat the migraines and how doctors can use these new methods in their work?
You know, this method, we have something through FDA approved that they said, and through these guidelines for controlling the headache. The most important things in controlling headache is to understand type of the headache. First time the patients come to you and said I have a headache, at first you must exclude the red flags through your examination and this question that you ask from the patient. If the, for example, headache, it don't differ, it's tension headache, migraine headache, any kinds of headache. Start newly, after 15 years old, you need to do a MRI and investigation. And also you need to check ESR and CRP for example, giant cell arteritis. If the patient says my pattern of the headache differ from tension to migraine, or from left side to right side, or the pattern of the pain is different, you need to do examination and do investigation. First of all, you must exclude the red flags. Second of all, through the type of the headache, you must choose the best and proper strategy for them. Mainly these days, because of the using tablets, laptop and phones, we have mainly cervicogenic headache. All of us have the experience of cervicogenic headache. When you are working with a laptop studying, because you are bending forward and rounding your shoulders, you have a pain on your neck, shoulders and back. This pain triggers the migraine headache. Through your examination, that finding these trigger points and also the posture of this patient sitting on the chair, you understand that these headaches are start from the cervicogenic source or it's pure migraine headache. So it's very important to differ these type, and also we rarely have, not rarely, but it's mixed type is much more common than isolated migraine headache. So you need to understand the type. And this third, you must find the trigger of the headache and eliminate. It's like the hypersensitivity. If you are hypersensitive, for example, to one peanut, for example, the best way of the treatment is elimination of the peanut. You must eliminate at the first step the trigger. For example, smoking is the trigger of the migraine. So you must stop the smoking or decrease the smoking. Because until you use the smoking, for example, shisha or cigarette, or using, for example, a spicy food. Spicy food is one of the triggers of the migraine. Until you continue these things, any treatment, any medication is useless. So finding the triggers and eliminate these triggers is very important. And this make difficult, this is the difficulty of the treatment and understanding the type of headache, because all of these headaches are mixed type. Through the patient's history, you couldn't exactly say this headache is typically, for example, migraine or tension or cluster. Also, we always have mixed type headache. So these 3 points, finding red flags, 2, the type of the headache, and 3, elimination the triggers, it's the main and the basic strategy of the headache management and treatment.
Now, when it comes to diagnostic challenges, what are the primary diagnostic challenges in identifying the migraines? And how can healthcare professionals enhance the precision in diagnostic methods?
And the first important things is the patient history. You must listen to the patient. Patients and tell them to go through details. The patients tell you which type of headaches they have. You must listen. Because headache, it's not a tumor that I go through CT scan and say, okay, this is a tumor on the, for example, this part of your body, this is the dimension. I saw the tumor. You saw the, for example, the lump on the hand. You saw, for example, the cystic ovarian by the sono. But pain is something that if I have a headache right now, how you can find? With which device you can find? Pain is something self-explanation. So I need to listen to the patient explanation. The first thing is listening to the patient. The second thing is the examination of the patient. Especially we need to examine the pupil edema. We need to fundoscopic the eyes to find if there is any pupil edema on the optic nerves or not, because it shows the rising the ICP. The rising of the ICP is very important because it's always misdiagnosed, or it's always underdiagnosed, because many medications that you use, for example, OCPs, for using for cystic ovarian or PCO, or using for protection. Accutane, Rokhsatyazdy, they use women especially for the acne, and they want to treatment of the acne. Vitamin A and their subgroups, many kinds of antibiotics, hypothyroidism, hyperthyroidism, using corticosteroids, obesity. They are the risk factor of the increasing the intracranial pressure. The intracranial pressure when increased, you can find it through the examination of the optic nerve by fundoscopy. If you have pupil edema through the fundoscopy, your diagnostic strategy change. Here is the problem that we couldn't use telemedicine in the first session, because we need to do this examination. When the patient said, I have a headache, just one examination you need to do, one physical, that's fundoscopic, for finding a pupil edema. If the patient have the pupil edema, you need to go through some investigations that completely differ from who do not have pupil edema. So the first thing is the listening to the patient, the second is the examination, and the third, you must gather these things together. Now you decide to use modern and new technologies such as MRI for the investigation. For example, in the cluster headaches, in 10% of the cluster headaches, the pituitary lesions made the cluster headaches. Or for example, in trigeminal neuralgia, you need to find any compression of the arteries on the trigeminal nerve that made trigeminal neuralgia worsen, that made they need to go through surgeries. So through these things, you need to do this investigation. But through AI, I really interested to go through this algorithm. We can go through this algorithm to find the type of the headache. But the first time we need to do this investigation, we understand that, for example, the pupil edema is eliminated. It's very simple. Nowadays, they are very automated device that you just put your head on this device. It's take a picture from your fundus, and we can see if there is any pupil edema or not. So we can go through the telemedicine by this technology to managing the headache. And if we have CT angio, MRI, MRA, in the intracranial hypertension, we need to do lumbar puncture, LP, for the measurement of the ICP. And also maybe we eliminate CVT by brain MRV with contrast to eliminate the CVT, and we could. The CVT, cerebral vein thrombosis, very important because it's really have you will experience some such patients, especially women in the childbearing age that using corticosteroid, or they are in the pregnancy because of the hypercoagulable states, for example for antiphospholipid, or in, for example, in the situation that they become hypercoagulable, and if they have the migraine and using cigarette, they smoking cigar, have a migraine and using OCPs, it's highly increase the risk of cerebral vein thrombosis. So in the patients, women who are suffering from migraine, I totally and strongly recommend them to discontinue OCPs and just use OCP as a treatment, not for the protection, and smoking cessation, because combination of smoking, OCP, and migraine increase by 45% risk of cerebral vein thrombosis in women. In women who they are pregnant or suffering from headache, they experience a sharp headaches. We name it thunderclap headaches, a headache that exploding something on their brain. They need to investigate for CVT and doing brain MRV with contrast, because it's very important, and it's very common in Muslim countries, because they are go through the fasting. The fasting decrease the water of the body. They deplete of using water. Then maybe they use OCP pills. These are get together and increase the risk of the CVT. So in or the patients who are going through this fasting regime for decreasing the weight, for weight loss, they are using this strong and tight regimes for controlling their weight. These are the main important things that they are come to my mind, and I share with you.
Thank you so much, Dr. Hamidreza, for giving us a very wide overview on diagnostic challenges and on ways how we can identify migraines. Definitely the first and the most important thing is to pay attention to what the patient says when it comes to any specialty in healthcare. Thank you for highlighting that. And moving on to our next question, we would also like to know about the importance of teamwork and collaboration when it comes to managing the migraine patients. Like, do neurologists collaborate with other healthcare providers when caring for migraine patients usually?
Yes, totally. During my explanation, there are many kinds of samples. There, I told many samples of collaboration with the gynecologists and obstetrics, with endocrinologists, because the patients who are suffering from diabetes or hyperthyroidism or anemia worsen the headache. Also, we have a brain-gut axis. The problems of the GI, like constipation or IBD or IBS, they have a close collaboration with increasing the headache and migraine headache, and we are totally and strongly advise the patients to control their GI problems, because to controlling the GI signs and symptoms, especially, for example, controlling and treatment of the constipation, because the constipation has a tight collaboration and strong adhesion to increasing the patient's headache. And also with psychiatrists and psychologists, stress is the main and commonest trigger of the headache. So we strongly recommend to our patients to go through stressful patients, go through the psychologist and psychiatrist, and go through this cognitive behavior therapy to controlling their stress, because the stress is the main trigger of the headache. Stress does not mean bad. For example, bad things, for example, some missing somebody or some failure make you stress. For example, the good stress, for example, marriage, immigration, new university, new hospital, new house, new job, they are stress also. The adjustment disorder, many of the patients, and nowadays through these wars that there are many immigration also in Dubai, that mainly there are immigrants, they come to Dubai. The adjustment to the new situation, new job, new community that they want to live within, it's very difficult for most of the people, and it's stressful. It's a good, you are coming to the new city, you start new job, you have a great encourage to do your job, but it's stressful. So managing the stress through these examples and triggers that I explained for you, you will understand that we need close contact and collaboration with other specialty in the medicine, especially with the endocrinologist, psychiatrist, obstetric, gynecologist, neurosurgeon, and also physiotherapy and chiropractic specialty for controlling these cervicogenic headaches. We need this combination to control the migraine and other kinds of headache. It's not just, I always tell my patients, do not rely just on one pill or two pills that I prescribe for you. You must go through the rehabilitation for your cervical pain and rounded shoulder, text neck headache. You must do some exercise. You must manage your stress through psychology, psychiatry, or self-control. You must learn. If you have any endocrinology problem, you must control it. If you have any problem with your GI, you must go through control it. If you have anemia, you need to control the anemia. You need to correct the anemia. It's not will be done by just one specialty, for example, neurologist. We need this collaboration with other specialty and other medical facilities to control the most and the effect in the best and the effective way to control the patient signs and symptoms in a shorter time with a less expenses for them.
Now, moving on to our final question for the day. Dr. Hamidreza, in the era of telemedicine, when it comes to migraines, how can healthcare professionals optimize virtual consultations?
We can follow the pattern of the headache, but the most important thing is the first session must be physical, because I told you we need to do some examination. But after that examination, that we understand that everything is okay, there is no abnormality in examination. After that, here we can use AI and telemedicine because I have a chart. I give this chart to my patient. AI is somehow what I do with my intelligence. I give it to the computer to do it. I made a chart for my patients. They need to feel where they have pain, how long they have pain. So you can make it as an application and give it to the patient. Okay, put this application, put your headache in this application, and if you have, and I can monitor it. And the application will understand when the pains it's more than 2 or 3 times per week, they give you alert, go to doctor. We can use this. It's need to be designed, and they are we can do very good things with the technology, we can have a good strategy with the technology to follow up the patient's headache. And also through this pattern that change, we understand that if there is any important things, is there any change in the pattern of the headache? Is the for example, episodic migraine headache change to the chronic migraine headache? So then this application gets me and my patient alert that something is going wrong. And also through this telemedication, because nowadays the prescription, all of them is online, and after the first session, we just speak with the patient and asking about the signs and symptoms, and that's enough for controlling the patient signs and symptoms. We can use this, for example, video online visit, or also using some applications to controlling and understanding the pattern of the headache and how is the patient management go through. So there are many new and there are many fields that they are not found by the neurologist and IT for using in the migraine. I think here is a very great place and era for using telemedicine. We can do much more than this, just a video call with the patients. We can go through the lifestyle of the patients, also specifically migraine patients, to control them as soon as possible. Because migraine is, I don't know, do you see the migraine patients? When the pain starts, it's some disabled patient. It's disabled, and he or she couldn't do their routine or ordinary job. They must stay at home. If they have 15 days of the headache per month, it means half of the month they couldn't work. They are useless for half of the month. They couldn't study, they couldn't go to the university, they couldn't do their family job, they couldn't go exercise. So it's disabling. It's very benign, but it's disabling. So we need to control the headache as soon as possible, and we need to use this telemedication and also AI to understanding as soon as possible that this headache is out of control, and we do our interventions as soon as possible for controlling patient's headache.
Dr. Hamidreza, a heartfelt thank you for bringing your wealth of knowledge to our MedSynapse podcast today. Your expertise in neurology, especially when it comes to managing migraines and headaches, has been enlightening and very valuable to us. Thank you so much.
You're welcome. Thank you for the time and the opportunity that you and your team give it to me for explaining the main concerns of the headaches and the migraine controlling and management. And I hope this conversation and this podcast, it will be useful for the people that they could help them for controlling and relieving their pain. Thank you for your time and for your attention.
We appreciate your commitment to personalized patient care and your approaches to integrating the new treatment approaches of migraine. And definitely, we're looking forward to many more interesting podcasts together, Dr. Hamidreza.
It would be great for me. There are many new topics in neurology and neuroscience. We can go through them.
Definitely, Doctor. And to our listeners, a big thank you for tuning in. We hope Dr. Hamidreza's expertise has shed a light on important aspects of migraine care. As we conclude today's episode, we extend our gratitude to Dr. Hamidreza for taking the time to share his insights with us today. Stay tuned for more engaging discussions on MedSynapse podcast by subscribing, liking, and being active on our platform. Until next time, take care, and thank you for being an essential part of our medical community. Goodbye.